We're recording this interview with Christine Zack on June 8th, 2020. We're going to discuss healthcare. What's your professional experience in the healthcare industry?
Thank you for having me here today. I have spent over 15 years on the corporate side of healthcare as a member of the executive management team. Currently, I am the president and CEO of Capability Health. Capability Health is the largest private sector provider of pediatric rehabilitation services for children aged 0 to 3 in the state of Nevada. And I also sit on the compliance board of directors for Avanti Hospitals in Southern California. And I teach in the UNLV School of Public Health, specifically law and ethics for healthcare managers. And while that's my professional background, which has given me a deep understanding of the healthcare industry, like all of us, we bring our personal experiences in healthcare when we think about the healthcare industry. So back in 2014, I was misdiagnosed with a brain tumor, a craniosacral brain tumor. That's a skull-based tumor, for those who aren't familiar with the anatomy of the brain and the head. And I had to seek medical advice from some of the top ophthalmologists and neurosurgeons in the country. I was fortunate to be able to consult with these very experienced physicians from California, literally to across the country to Maryland, where fortunately I got a new, much better diagnosis. But through that experience, I realized how critical access to quality healthcare is. And that is why I've become such a passionate advocate for access to quality healthcare services.
What would you say is the most striking indirect impact of COVID-19 on the healthcare industry?
That's a really interesting question. Based on what I've witnessed, I would say that the most striking impact has been in the rapid innovation and expansion of telehealth for healthcare services in the United States. Telehealth, for those of you who are not aware, is the use of a telecommunications device to provide healthcare or medical services. So typically, people think of going to see a physician or a nurse or going on site to a hospital to receive services. Telehealth actually allows you to use a device such as your smartphone or tablet or computer to meet with a healthcare professional virtually and to receive diagnosis and treatment for a health condition. Prior to COVID-19, there was a problem with reimbursement in the United States for telehealth services. It was limited prior to the pandemic, and as a result, telehealth was not used in all medical specialties. So I mentioned the word reimbursement, and I know that we have a global audience here, so I want to make sure that everyone has an understanding of the American health system and how payment is typically rendered for services. So in the United States, a patient typically goes to see a healthcare provider and may have a very small amount of money they have to pay up front, called a copay. And then the healthcare provider actually bills a health plan, whether that's a commercial, private health plan, or the federal-run Medicare or a state-run Medicaid health plan for the service. And that healthcare provider receives reimbursement for that service 30, 60, or 90 days in the future after the service is rendered. Now, I mentioned Medicare and Medicaid. So Medicare is a federally run health plan that provides coverage for Americans who are age 65 or older who have a disability or have end-stage kidney disease. Medicaid, while federally funded, is administered by the states. Each state has a very different Medicaid program, and Medicaid is intended to cover low-income individuals and families. According to the U.S. Census Bureau, over 30% of Americans are on Medicare or Medicaid, which is a very large percentage of the population. Prior to COVID-19, Medicare and Medicaid did not provide expansive coverage for telehealth services, which means that that providers could not get reimbursed if they provided their medical service via telehealth. Therefore, it was limited to certain specialties and to individuals who could afford to cash pay for telehealth services. During the pandemic, Medicare and the state Medicaid divisions moved very quickly to expand coverage for telehealth in the United States. And they issued things called temporary waivers, which expanded that coverage and allowed more Americans to access telehealth services and a broader array of subspecialties within the medical field.
Do you see any impediments to continuing this expansion of telehealth?
I do. So the first is Medicare and Medicaid, these programs. I mentioned that there are temporary waivers in place. So the first impediment is that we need these waivers to be expanded to a long-term and permanent basis. The second impediment, which you probably wouldn't think of when considering healthcare services, is the broadband infrastructure in the United States, particularly in rural America. So broadband internet access is basically a fast internet connection. It means that you connect fast, that you have a steady connection, that it doesn't drop. Many of us probably remember the early days of the internet where we used a phone system to quote unquote dial up or dial into the internet. And it could take an hour to connect, and the connection just was not reliable. It dropped off frequently. Because telehealth requires the use of audio and visual communication, you really need to have a high-speed broadband internet connection in order to facilitate telehealth. Telehealth requires a steady, fast internet connection due to the video transmission involved with the nature of telehealth services. During the COVID-19 pandemic, the U.S. federal government passed the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, and the Federal Communications Commission created the COVID-19 telehealth program. The CARES Act actually allocated $200 million in funding, in federal funding, for telehealth initiatives in order to prevent the spread of COVID-19. Through the COVID-19 telehealth program, the Federal Communications Commission will distribute the $200 million from the CARES Act to healthcare providers to help patients in rural communities and elsewhere in the United States access telehealth services. Broadband connectivity is one of the eligible services that will be covered under this program. Unfortunately, however, there is not an expansive list of healthcare providers that are eligible for this funding. Nonetheless, it is striking that there is federal money allocated to improve broadband connectivity throughout the United States in order to ensure all Americans have access to telehealth.
Can you provide an example of a critical area of healthcare that might be overlooked for long-term and permanent expansion?
Yes. So speech language therapy services, particularly in early intervention, which is for children age 0 to 3, is an area that I'm very concerned will be overlooked. Yet it's so critical that we focus on continuing telehealth in this practice area. Based on statistics from the National Institute of Health, the prevalence of speech sound disorders in young children is 8 to 9% of the American population. And the incidence of language disorders is estimated to be between 2% and 8%. There's additional research from the National Institutes of Health, which suggests that 1% of the US population, adults and children included, have a stutter, which is probably the most common speech disorder that we are all aware of. And when you look at those numbers on a global basis, there are 15 million people in the world that are experiencing a stutter, type of speech language disorder. Research by the National Institutes of Health suggests that the most critical time period to receive speech therapy services is in children up to 6 months of age, which may just seem striking to us. Those are infants, those are babies. And it's certainly critical to have these speech therapy services provided on a regular basis before the child starts school, and it may be too late. Based on these statistics, I can confidently say that it is critical, it is imperative that we continue the expanded coverage for telehealth and early intervention, and specifically for speech therapy. Prior to COVID-19, some states used telehealth in early intervention on an adjunct or as-needed basis. But it was being used when there was a provider shortage or there was an access issue in a rural part of a state. Telehealth was not being used as the primary means of delivering early intervention services. The reason is because one of the core pieces of early intervention is that the service should be provided in the child's natural environment. So prior to the COVID-19 pandemic, it was thought that the only way to deliver the service in a child's natural environment was to deliver the service where the child lived, which was frequently at home. One of the most fascinating indirect impacts of the COVID-19 pandemic on early intervention services for me was discovering that providing early intervention services via telehealth actually provided better insight into how to best provide speech therapy services, and also that telehealth resulted in a higher quality of care being provided. I'd like to share with you the story of an early intervention patient named Mariah. Mariah was a patient in early intervention, both prior to the COVID-19 pandemic and during the pandemic. At age 2, Mariah was unable to communicate with her parents. She couldn't speak a word, let alone a phrase or a sentence. Prior to the pandemic, Mariah's parents elected to enroll her in early intervention services. A speech therapist started coming regularly to their house to provide speech therapy services. And within a couple of months, Mariah's parents not only witnessed her saying her first words, they watched her rapidly start saying phrases and full sentences, and they were suddenly able to communicate with their daughter. Then the pandemic hit, and Mariah's family was offered to continue early intervention services via telehealth when the state in which they lived prohibited in-person services. Mariah's mother was very concerned that therapy services via telehealth would be unproductive with her young child. However, what was discovered was that instead of being unproductive, it was an incredible opportunity to witness Mariah in her true natural environment. Based on feedback from Mariah's speech therapist, I learned that Mariah behaved differently when the speech therapist would come to the house than what she was observing via telehealth. And so as the speech therapist considered that, she realized it was because she was a stranger in their home. I'm sure all of us have had an experience where a young child in our life has reacted differently to a member of the community or someone outside the immediate family, someone who didn't live in their household. And that child may have acted very differently than they do around mom and dad. In the US, we jokingly call that stranger danger. Well, it turns out that early intervention is not immune to stranger danger. Mariah's speech therapist realized that Mariah was acting more naturally via telehealth. The speech therapist was able to observe Mariah, observe her interaction with her parents, and also observe the communication style. And it gave her this window into the true day-to-day activities of Mariah and her family. This allowed the speech therapist to provide more appropriate feedback, thereby elevating the quality of service that was provided to Mariah and to her family. Without the pandemic, Mariah would not have received the highest level of speech therapy services that she was being provided in the home. And it would not have been discovered that telehealth promotes early intervention's goal of providing services in the child's natural environment. During the public health crisis caused by COVID-19, telehealth allowed families across the country to access high-quality healthcare services while they sheltered in place at home, and while healthcare providers were likewise able to shelter in place at home, which ultimately served the goal of helping to prevent the spread of the virus. Continued innovative uses of telehealth and increased broadband connectivity should be championed as we emerge from this global pandemic. They truly promote access and high-quality healthcare services, regardless of income, regardless of where you live, and creates health equity for all.
Thank you.
Thank you.